Hi, we're here at the cottage, and today's blog is about avoiding the back attack, or what to do when you're in the back attack. Now, it's been a slow start to the gardening season, and many of us are trying to get way too much work done in too short of a time frame, and that definitely sets us up for a back attack. Or sometimes it can be more subtle than that. We just wake up with back pain and suddenly we can't straighten up, or we've got radiating leg pain and it's sharp shooting. And unfortunately then, instead of spending the afternoon kayaking, you're probably going to be spending the afternoon taking care of your back. When this happens, you've likely missed the warnings. And the warnings are the subject of my next blog. But today what I want to talk to you about is how to manage the attack, because there are some common mistakes that I'd like to help you avoid. So the first one is that when you've got the sharp shooting pain and this intense pain, thinking that there's something very serious wrong with your back. Yes, it hurts, but on the whole, back pain is not serious. It is going to go away, and generally you've got a 95% chance that it'll go away within 3 months. Although I understand that that can seem like forever, it will be comforting as you wake up morning after morning and it hasn't yet gone away. It will reduce and it will get better over time. During this time, it's important to not let your headspace get out of line with it as well. It's what I call being a prisoner of the pain. And in it, you're so worried there's something wrong with you that it's hard to heal. And it's hard to heal also because we tend to start making bad decisions because we're worried about it being something more serious. So take some deep breaths, go and see your family doctor, maybe consider some medication, and recognize that you are eventually going to get out of this pain, either with the right direction or just with time. Now, the first thing to recognize is the signs of being in the back attack. And it may seem obvious, but it's sometimes confused with the first stage of resolution, which it will be another one of my topics. So in the back attack, your pain is constant. No matter what you do, it's unrelenting. And you can shift positions, but the pain never seems to end. You go on and you read in the internet that you need to have a diagnosis on your back pain, and you go and see people and they can't tell you what's wrong with them. Don't think that this means that there's something more serious wrong with your back. At the beginning, almost all pain has the same cause. We call it varying nociceptive, inflammatory, acute stage. But what it means is at the beginning, your body is releasing chemicals, and the chemicals released into the tissues are irritating the tissues. Now these these chemicals are not all bad. They also help you to heal, but recognize that while you're releasing these chemicals, there will be pain, and if you do make decisions that increase the release of the chemicals, then what happens is you prolong the response. So this takes me to the most common thing that people do wrong, and that is, do I rest or do I exercise? And there's really conflicting advice on that. Your body probably tells you that you want to rest, and yet the internet tells you that you want to move. This is not the time to start your core exercises. It is also not the time to take to your bed. We need some movement, some circulation, some light motions to help our circulation, but you don't want to do your full core. So move as you feel comfortable, but don't overdo it. You may also want to see your family doctor about some medication, and the medication doesn't necessarily have to be the big hitting medication. Sometimes some light medication will just let you start to move so that you can get a little bit more exercise and motion in without doing the full exercise. Do you see your therapist at this stage? Well, you see your therapist if your therapist helps you. Sometimes some of our treatments can help your pain. For example, we might do some hands-on, we might do some modalities, some acupuncture. But if they don't work, don't worry about that. The biggest value with seeing your therapist is in the next stages, in the resolution, where they're going to give you advice on how to get back into exercise and fully restore so that you can return to your full activity level. At the beginning, if their hands-on treatment and modalities don't help, then have a chat with them about your plan of how to return to activity so that you know you're making good decisions at this time. Thank you, and we'll see you again in about a month.